Hello everyone, my name is Shruti Tomar. Today we are going to see the topic pesticide. So, what is pesticide? A pesticide is a chemical substance which is used to control pests. The pest may be insect, plant disease, fungi, weeds, nematode, snail, slug, etc. Pesticide will be classified into herbicide, insecticide, rodenticide and nematicide. Now, we are going to see the topic insecticide. So, what is insecticide? It is a chemical which is used to kill insects which pose a threat to various crops or to human health. Insecticide will be classified into anticholinesterase, chlorinated hydrocarbons and pyrethroids. Anticholinesterase will be further classified into organophosphates and carbamates. Organophosphates include chlorpyrifos, malathion, diazinone, dimethoate and dichlorvos, while carbamates include propoxur, carbaryl and aldicarb. Chlorinated hydrocarbons include DDT and linden, while pyrethroids include alethrin, deltamethrin, cyalothrin, cypermethrin and phenvalerate. Now coming on anticholinesterase insecticide, they are a broad spectrum insecticide act by polarizing the insect due to persistent depolarization of muscle end plate. Organophosphate and carbonate used effectively as a plant protector. Mechanism of action of anticholinesterase insecticide is cholinesterase has both stearatic and ionic side. Organophosphate bind covalently to the stearatic side of the cholinesterase and inhibit them irreversible, and hydrolysis of phosphate enzyme is extremely slow. The adverse effects of anticholinesterase include sweating, salivation, lacrimation, muscarinic effect like bronchospasm, vomiting, abdominal cramp, nicotinic effect like switching, muscle weakness, paralysis, while central effect like headache and restlessness. Treatment for anticholinesterase poisoning is atropine. 2 mg IV stat is given in a repeated manner in 5 to 10 minutes. Doubling is required if patient is fully atropinized. Now coming on chlorinated hydrocarbon insecticide, DDT. DDT is the first member of this class, was extensively used as an all-purpose insecticide including mosquito control. It is unfamous because of its non-degradability in the nature and the consequent environmental impact. Mechanism of DDT is the chlorinated hydrocarbon act at the picrodoxin binding site of the GABA receptor and interfere with the GABAergic transmission in the insect. They also interfere with the sodium channel inactivation, resulting in the repetitive firing of neuron and are neurotoxic. Adverse effects of DDT include nausea, vomiting, diarrhea, irritation of eyes and the mucous membrane, tremors and seizure, and on chronic exposure it causes liver and kidney damage. Now coming on pyrethroid insecticide. Mechanism of action. Pyrethroids are the excitotoxin for the insect axon. They bind to and prevent voltage-gated sodium channel in the axonal membrane. Initial activation followed by paralysis. At a higher concentration, they also act on the voltage-gated calcium channels and on chloride channels. Adverse effects include irritation of skin, burning in eyes, airway irritations, cough, wheezing, systemic effect like dizziness, headache, palpitation and fatigue. Now coming on rodenticide. So what is rodenticide? Rodenticide is a chemical substance which is used to kill rats. It is classified into anticoagulants and metal phosphates. Anticoagulants include warfarin, while metal phosphate include aluminum phosphate. Now coming on aluminum phosphate, it is used for the fumigation of grain storage areas. Mechanism of action of alphos include it produces pH3 gas on the coming in contact with the moisture or gastric acid. Once it gains access to bloodstream, it reaches various tissue and at cellular level inhibits the mitochondrial respiratory chain and hence lead to cell necrosis and death. Adverse effects of alphos include nausea, vomiting, abdominal pain, altered mental state, seizure and arrhythmias. Now coming on herbicide, it is a chemical substance which is used to kill weeds. It is classified into non-selective herbicide, selective herbicide, contact herbicide and systemic herbicide. So what is non-selective herbicide? It is a herbicide which kills all plants that coming in contact, while selective herbicide are the herbicide which kill only selective plants. Contact herbicide are the herbicide which kill only particular parts of the plant that coming in contact. Example, paraquat. While systemic herbicide is the herbicide which kills plants by damaging its phloem and xylem. Example, glyphosate. Now coming on paraquat, it is a non-selective herbicide. It is an oxidant. It is an oxidant which interferes with the electron transport and inhibit photosynthesis. Adverse effects of paraquat include ocular and dermal irritation, damages lung, liver, heart, and kidney. It also causes vomiting and hematemesis. Now coming on fungicide. It is applied to prevent epidemic fungal disease. Majority of the fungicide are fungiostatic, not fungicidal. It is classified into inorganic fungicide like copper phosphate. Organic sulfur fungicide include mancozeb and thirim. Organophosphorus fungicide include isopropyl. Benzimidazole fungicide include carbendazim, and azole fungicide include hexaconazole. Now coming on question answer series. So question number 1. Treatment for organophosphorus poisoning is option number 1 atropine, option number 2 aspirin, option number 3 malathion, and option number 4 carbaryl. Question number 2. Which among them are not the rodenticide? Option number 1 warfarin, option number 2 zinc phosphide, option number 3 aluminum phosphide, and option number 4 malathion. Now coming on question number 3. What is the mode of action of paraquat? Option number 1 insecticide, option number 2 herbicide, option number 3 rodenticide, and option number 4 fungicide. Question number 4. Pyrethroid insecticide does not show its action on which receptor? Option number 1 sodium channel, option number 2 calcium channels, option number 3 chloride channels, and option number 4 potassium channels. Now coming on question number 5. Inorganic fungicides like copper sulfate show following action. Option number 1 fungistatic, option number 4 fungicidal, option number 3 both 1 and 2, and option number 4 none of this. Thank you.